Hello, I'm Dr. Michael Teplitsky. I'm a medical doctor practicing internal medicine, alternative, holistic medicine in New York for over 30 years. Today we'll be talking about natural hormone replacement for women going through menopause or who have already gone through menopause. So we'll be talking about natural estrogen and natural progesterone. Now, when I say estrogen, it sounds like there is just one thing called estrogen, but actually there are many substances that are estrogenic, and the three most important ones are estrone, estradiol, and estriol. And estradiol is probably the most potent and the most important of the three. Young women who have their periods need to have a lot of estrogen and a lot of progesterone in order to ovulate and in order to be able to become pregnant. But estrogen and progesterone are important not only for that, but for many other parts of the body. Brain needs estrogen and progesterone, heart, bones, skin, muscles, you name it. When a woman reaches the point where she no longer has her periods, we call it menopause. At that point, she doesn't need a lot of estrogen and progesterone anymore because she cannot become pregnant. So the level of estrogen and progesterone are supposed to drop to about 10% of what they used to be because she doesn't need more than 10% to maintain the brain and the bones and the muscles and the immune system. The problem is that in many women, it drops way under that. In fact, I've seen hundreds of women whose levels were zero. Why that happens, I'll have another video about it one day, but for right now, you need to know that that is the reason why so many women go through menopause and have all kinds of symptoms like hot flashes and mood swings and night sweats and many other unpleasant symptoms. And if you think about it, none of that should happen. Menopause is not a disease. It's a normal condition. It is expected. We know it's going to happen, and it's just as natural as taking a breath. When you do that, it should not hurt. Well, going through menopause should not cause any symptoms, but so many women do have symptoms because their levels drop too low. So what do? For many, many years, doctors prescribed to women who had menopausal symptoms two drugs, which are like fake estrogen and fake progesterone. They look a little bit like estrogen and a little bit like progesterone, but they're not real. So they do relieve the symptoms, but studies have shown that they can also cause higher risk of breast cancer, uterine cancer, and heart problems. These two drugs, by the way, are called Premarin and Provera. So what's the alternative? It's either go through the menopause with the symptoms and face all the problems associated with low hormones, or do something else. I suggest do something else. And that's called the BioIdentical natural hormone replacement. It turns out that we have available natural bioidentical hormones, exactly the same as the natural estrogen and natural progesterone. You cannot tell them apart. They are bioidentical. That's what the name means. And so when you use them, not only your symptoms improve, you also improve all those tissues that suffer from the lack of hormones, the bones and the muscles and the brain and the heart and so on. Now, when we do this bioidentical hormone replacement, we try to bring the level to where it should have been, 10% of what a young woman had. So we never try to raise it very high, just a little bit to get rid of the symptoms and to maintain the tissues. Now, you do need a prescription, and you need to work with the doctor who knows about it, because most doctors don't even know that these things exist. They only know about Premarin and Provera, the synthetic stuff. But if you do have problems, if you are going through menopause, if you're having symptoms now, or if you have gone through menopause and you're concerned about your future health, about your bones, about your brain, call me. I've treated thousands of women over the years, and I can definitely help you. I do phone consultation with people all over the country, actually all over the world. We can arrange for a blood test, and if you need treatment, then I'll tell you how to get it. So call my office, 718-769-0997, 718-769-0997. Don't forget to like this channel and to subscribe. And look for part 3 of this series, where I'll discuss natural hormone replacement for men with natural bioidentical testosterone. Until then, I'm Dr. Michael Triplitsky, wishing you the best of health.